Welcome to NurseEdScholar. Today's video will begin with an unfolding scenario. Let's begin. Your shift starts on a bustling medical surgical floor, and the air is filled with the quiet hum of machines and the hushed voices of healthcare professionals. Each day brings new challenges, and today is no exception. You receive a detailed report on Mr. Henderson, preparing you for the complexities of his care. Mr. Henderson is a 68-year-old gentleman with a history of chronic kidney disease. He was admitted following a fall at home and now requires careful monitoring and skilled nursing intervention. As you enter his room to begin your assessment, you immediately notice that he's unusually tired and lethargic, far more so than described in the report. He's answering your questions slowly, and you detect a slight slurring in his speech, which raises a red flag. His breathing is now rapid and deep, a stark contrast to his baseline respiratory pattern. This is an alarming change from earlier assessments, demanding immediate attention. You quickly check his chart, noting that his morning vitals were within normal limits, but now his blood pressure is significantly lower than his established baseline. His skin is cool and clammy to the touch, a concerning sign of compromised circulation. Furthermore, he complains of nausea and profound weakness, adding to the growing list of concerning symptoms. Your nursing intuition, honed by experience and training, tells you that something serious is rapidly unfolding. Despite the other alarming signs, his oxygen saturation remains adequate, suggesting that respiratory distress isn't the primary driver of his current condition. The combination of lethargy, the presence of small respirations, and the concerning hypotension strongly suggests an underlying metabolic problem is at play. These symptoms, taken together, are classic indicators of metabolic acidosis, a dangerous and potentially life-threatening buildup of acid within the body's fluids. Recognizing these critical patterns and subtle changes in patient condition is a fundamental and vital nursing skill. Mr. Henderson's case serves as a textbook example, highlighting the importance of astute clinical observation. It clearly illustrates the potential for metabolic acidosis to develop in a patient with pre-existing chronic kidney disease. His body is now struggling to compensate for the acid imbalance, and the situation is rapidly deteriorating. Therefore, your quick and accurate assessment is absolutely crucial in determining the appropriate course of action. A deep understanding of the underlying pathophysiology of metabolic acidosis is what ultimately guides your next critical steps in managing Mr. Henderson's care. Your prompt recognition of these signs and your decisive action can truly make all the difference in ensuring a positive outcome for Mr. Henderson. What's happening inside Mr. Henderson's body? Let's take a closer look at his condition and try to understand the underlying mechanisms at play. Metabolic acidosis means the blood's pH drops below 7.35. This is a critical threshold, indicating an imbalance in the body's acid-base regulation. This occurs due to an excess of acid accumulating in the bloodstream, or conversely, it can result from a significant loss of base, specifically bicarbonate. Bicarbonate, HCO3, acts as a crucial buffer, working to neutralize acids and maintain a stable pH. When this buffering system is overwhelmed, the blood becomes acidic, leading to a cascade of physiological effects. This can happen if the body produces too much acid, such as in diabetic ketoacidosis. It can also occur if the body loses too much bicarbonate, perhaps through severe diarrhea. Or, in cases of kidney dysfunction, the kidneys may be unable to effectively excrete acid, contributing to its buildup. The lungs try to compensate for this imbalance by breathing faster and deeper, a process known as respiratory compensation. This specific breathing pattern, small respirations, is a hallmark sign of metabolic acidosis. The goal is to blow off excess CO2 and in turn, raise the blood's pH back towards a normal range. Key lab findings will reveal a low pH, indicating acidity and low bicarbonate levels. You'll also often see a low PaCO2 as the body attempts to compensate through hyperventilation. Recognizing these characteristic lab patterns is absolutely key to making an accurate and timely diagnosis. It's important to remember that metabolic acidosis is distinct from respiratory acidosis, a different type of acid-base imbalance. Respiratory acidosis, in contrast, is primarily caused by the retention of CO2 due to impaired lung function. A thorough understanding of the body's compensatory mechanisms is crucial. It helps you accurately interpret both the patient's symptoms and their lab results. Quick and accurate identification of metabolic acidosis is paramount as it leads to faster and more effective care, ultimately improving patient outcomes. Metabolic acidosis, a condition characterized by an excess of acid in the body, is not a disease in itself, but rather a symptom of an underlying problem that needs to be identified and addressed. It indicates that the body's delicate acid-base balance has been disrupted. One common cause is uncontrolled diabetes. When diabetes is poorly managed, it can lead to a dangerous condition called diabetic ketoacidosis, DKA. DKA occurs when the body, lacking sufficient insulin, starts breaking down fat for energy, which produces acidic ketones as a byproduct. Another significant cause is chronic kidney disease. The kidneys play a vital role in regulating the body's acid-base balance. When kidney function is impaired, the body's ability to excrete acid is compromised, leading to acid buildup. Certain toxin ingestions, like an aspirin overdose, for example, or the ingestion of methanol or antifreeze, can rapidly overwhelm the body's buffering systems and dramatically increase acid levels. Severe diarrhea, through excessive loss of bicarbonate, which is a base, can disrupt the electrolyte balance, tipping the balance toward acidosis. Poor tissue perfusion, whether from shock or severe dehydration, deprives tissues of oxygen, leading to lactic acidosis, a buildup of lactic acid in the bloodstream. Furthermore, malnutrition or adherence to high-fat, very low-carbohydrate diets, such as ketogenic diets, can also increase ketone production and potentially contribute to metabolic acidosis. Knowing these common causes is crucial because it helps you proactively identify patients who are at a higher risk of developing this dangerous condition. In the case of Mr. Henderson, his pre-existing kidney disease significantly elevates his risk profile for metabolic acidosis. Therefore, it's essential to stay alert for these potential triggers in all of your patients, especially those with predisposing conditions. Metabolic acidosis presents with clear signs. Watch for Kussmaul respirations, deep, rapid breathing as the body tries to expel CO2, neurological changes, confusion, drowsiness, or even coma as acidosis worsens. Muscle weakness and twitching may occur. Cardiovascular effects, tachycardia, hypotension, and possible arrhythmias. Skin may be cool and clammy as perfusion drops. GI symptoms, nausea, vomiting, and abdominal pain are common. These symptoms often worsen the acidosis through fluid and base loss. A thorough head-to-toe assessment is essential. Recognizing these patterns allows for timely intervention. Once metabolic acidosis is suspected, it's crucial to act quickly. Monitor vital signs, respiratory pattern, and cardiac rhythm closely. Obtain and interpret labs, ABGs, electrolytes, glucose, and kidney function. Address the underlying cause, fluids for hypotension, insulin for DKA, or prepare for dialysis if needed. Administer sodium bicarbonate only if ordered, and monitor for complications. Implement safety measures for confused or lethargic patients. Educate and support the patient and family throughout their care. DKA is a life-threatening complication of diabetes and a classic cause of metabolic acidosis. It's triggered by a lack of insulin, causing the body to break down fat and produce acidic ketones. High blood sugar leads to dehydration and electrolyte imbalances. Nursing priorities, aggressive IV fluids, insulin infusion, and careful monitoring of glucose and potassium. Watch for hypokalemia as insulin shifts potassium into cells. Frequent lab checks and cardiac monitoring are essential. Rapid, coordinated care is critical for survival. Mastering metabolic acidosis takes time and practice. Build a strong foundation. Understand the why behind symptoms and interventions. Connect textbook knowledge to real patient scenarios. Communicate clearly with your healthcare team and trust your instincts. Your vigilance at the bedside is vital for patient safety. Continuous learning and experience will build your confidence. Each patient encounter is a chance to grow. Your competence will save lives. Keep striving for excellence. If you enjoy this content, please like, comment, and subscribe to NurseEdScholar. I look forward to seeing you in the next video.